stability of the lumbar spine. We know very well stability will be provided by the ligaments and muscles. Ligaments and muscles. Ligaments we discussed already. All the vertebral column, 6 ligaments, and 2 special structures will be there. Those 2 special. First one, thoracolumbar fascia. Thoracolumbar fascia will be there, and second point, iliolumbar ligament. Iliolumbar ligaments will be there. So these are the 2 special structures. So what this stability means? What are the movements of lumbar spine? Lumbar spine movements here mostly flexion, extension. Flexion, extension will be more in the lumbar spine, and lateral rotation and rotation will be very minimal, very minimal. So these are the movements we are having in the lumbar spine. Stability means when the spine is going for movements, again it should come back to normal position. That is nothing but the stability. And one more point here, we have some forces. Which forces? Axial compression force. Axial compression force will be there, and tensile force will be there, and then here we will be having torsional force will be there, and shear forces. So stability means movements are happening, and when the forces are acting on the lumbar spine, at these 2 places, again after the end of the movements, after the removal of the forces, the lumbar spine should come back to normal anatomical position. That is nothing but the stability. So which structures will helpful for the lumbar spine to get the stability means here ligaments and muscles. Especially here we can say about intervertebral disc also. Ligaments, muscles, intervertebral disc, these are going to helpful. Suppose if you see movement, flexion and extension, how these movements will happen. Here we should see facet orientation in lumbar region. Facet orientation, how it will be: backward, upward, and medially. And it is going to make a 90-degree angle with the sagittal plane. So because of the sagittal plane, here possible movements are flexion, extension more. Okay, these are the movements. So here if you see backward, upward, and medial. So if we see flexion, extension movements, if the patient is doing flexion movement, here facet joints are going to stop the further movement. Facet joints are going to stop the further movement. How it will stop? Suppose this is one vertebra. Here will be having superior articular facet. Okay, this is one more vertebra. So sorry, this is inferior articular facet. Okay, this is inferior articular facet. This is superior. Here one more vertebra we are having. This vertebra is having here superior articular facet. Okay. This is facet joint. Imagine it is L3 and L4. So the facet joints are going to stop the further flexion and extension. Okay, first we will see the flexion. Facets are going to stop the further flexion movement in the lumbar spine. How means? It is just because of the orientation of the facet joints. So here, if you see superior articular facet, inferior articular facet, if the superior articular facet, again I am drawing here. This is inferior articular facet. This is superior articular facet. Okay, so this is our spine. Okay, body of the L3 and L4. If the superior articular facet face more posteriorly, if it is going to place more posteriorly, facet is going to show more posteriorly, then the resistance for flexion extension will be more. If the articular facet orientation, if the facet is posterior, then the resistance for flexion extension will be more. Suppose if we take axial rotation, here this is our superior articular facet and inferior articular facet. If the facet is going to face medially more, then the resistance for axial rotation will be more. So if the articular facets are facing medially, then it is going to provide resistance for the axial rotation. It is going to face posteriorly means then it is going to provide resistance for the flexion and extension of the lumbar spine. Point, axial compression of the lumbar spine. Suppose if we take this is our lumbar spine, okay, L1 to L5. Here we will be having lumbar spine. The total body of the head and trunk and arms. Suppose head, okay, neck, and these are the arms, and this is the trunk. Okay, here thorax, this is abdomen. Okay, the total weight, head, trunk, arms, it is going to give a compressive axial compression on the lumbar spine. So the lumbar spine has to take that weight, bear that weight, and in that time the weight will transfer from the body of the vertebra, and then here vertebral emiplates will be there. After that, here will be having intervertebral disc, IVD will be there. Then again it will give weight to the behind vertebra, below vertebra. So in this axial compression, the lumbar spine has to bear the weight. Okay, usually we know the weight of the body means center of gravity will be at the anterior to the second cervical vertebra if the person is in anatomical position. But according to the position of the patient, this COG will change. Suppose if you take one person, here the line of gravity will be like this. So here center of gravity. In anatomical position, if center of gravity is this, line of gravity will be like this. So the distance between this line of gravity to this lower limb, will be same. So that here there is no any other force acting on the lumbar spine other than axial compression. Okay. Suppose if the patient bend like this, so then what will happen? The line of gravity will change. Line of gravity position will change. If the line of gravity position will change means then here some muscles will go for contraction. If the muscles are going for contraction means here a kind of forces are generating inside the body to keep the spine neutral position. So this is about the axial compression. The lumbar spine has to take the axial compression. If it is taking axial compression, that time if there is no other force acting on the lumbar spine, then lumbar spine can able to take the axial compression. If other than axial compression, if any rotations are happening or side bending or positioning of the patient, if the positioning of the patient change means, then center of gravity will change. If one center of gravity will change, then automatically line of gravity will change. So to make the patient neutral position, some muscles of the thoracolumbar fascia and abdominal muscles has to work to keep the lumbar spine in the neutral position. Okay, let's see one example how we discussed here. Other than axial compression, another force like another torque. Okay, another torque if it is acting on the lumbar spine. Suppose here one person is there, he is okay standing, he is standing, so he is carrying a kind of box on right side. So in this case what will happen, because of the weight of the box, gravity will always pull, no, gravity will always pull the body, mean gravity will act on the weight of the box, center of gravity, so that here possible two movements may happen. Two torques can produce. What are those means? Forward flexion of the spine, and at the same time right side lateral flexion of the spine. So these two possible torques can produce in this case. So to keep the spine in equilibrium position, according to Newton's first law, if one object should be in neutral position, means the forces acting on that object should be, the sum of the forces should be zero, then only object will be in equilibrium. Okay, so here already two torques are acting, forward flexion and right side lateral flexion. So to prevent the spine to go for flexion and right side lateral flexion, here muscles has to contract. Contract means like counteraction, right? Counteraction to the center of gravity, counteraction to the. So here spine is going like this, it can go right side flexion and forward flexion. So to prevent that, here muscle has to contract. Which muscle has to contract here means, here the trunk, here lumbar muscles and trunk muscles. Simply we can say like thoracolumbar fascia and abdominal muscles. So this muscle has to counteract for this two torques which is produced by the center of gravity. Then the lumbar spine is going to maintain in the equilibrium position. So this about these forces. Okay, one more regarding axial compression. If we will take two, here we are taking two. Okay, two cases, two situations. First one standing, second one like running or walking. Okay, like running or walking. So if we take the person, when the person is in standing position, the axial compression which is acting on the spine is less compared to the running and walking. If you compare the axial compression when the patient is running and walking, that time the axial compression will be more compared to the standing. But if you take only standing, here the axial compression which is acting on the spine, it is more than the body weight. So here also it is more, but when we compare this thing with the running or walking, then it is less compared to this. Okay, and here the last point, stability of the lumbar spine. Muscles are going to play a key role to maintain the lumbar spine in stability. And here again we have to discuss about the ligaments. So the ligaments and muscles together are going to provide the stability for the lumbar spine while doing the movements, flexion, extension and lateral flexion and rotation movements. And at the same time, when the forces are acting on the lumbar spine, axial compression, here we discussed axial compression. Okay, axial compression, otherwise shear forces means like this, when shear forces are acting on the spine, so that time muscles and ligaments will work together and they are going to provide stability to the lumbar spine. Clear?